Well, good evening once again. Day 205 of the Biden administration. Tonight, a troubling new sign of the Delta variant's increasing hold on our country. The CDC now says the strain is driving this latest surge in almost every county.
Over 90% of counties in the United States are experiencing substantial or high transmission. Those at highest risk remain people who have not yet been vaccinated.
You heard her. 90% of U.S. counties. A new Washington Post analysis revealing 2/3 of Americans in even highly vaccinated counties now live in virus hotspots. FDA is working with Pfizer and Moderna to allow that third vaccine dose for people with vulnerable immune systems. Agencies expected to green light that after a CDC meeting tomorrow. Newsweek reporting the CDC estimates more than 1 million people who have already received a Pfizer or Moderna vaccine. They have opted to get a third, but this is unauthorized, of course. Dr. Fauci said tonight it's still not necessary for most of us.
We don't feel that right now those people, namely the general normal population of people who are not immune compromised, that they don't need a boost right now, but we are preparing for the eventuality of having to do that.
Meanwhile, the nation's largest teachers union, the NEA, now behind a vaccine mandate for educators. Federal Department of Health and Human Services says all of its healthcare employees have to be vaccinated. San Francisco's mayor today announced some of the nation's toughest restrictions, barring the unvaccinated from, quote, a number of indoor settings, including bars, restaurants, gyms, and large events. Today, a Supreme Court justice shot down the first legal challenge against vaccine requirements. Justice Amy Coney Barrett refused to block a requirement by Indiana University that all their incoming students must be vaccinated. There is new reaction tonight from the video we showed you last evening of protesters threatening healthcare workers in Franklin, Tennessee, after that school board meeting on mask mandates.
Will not comply! Will not comply! Will not comply! Will not comply! More masks! We know who you are. We know who you are. You can leave freely, but we will find you, and we know who you are. You will never be allowed in public again. You will never be allowed. You'll never let us be allowed in public again.
An extremely ugly scene in Franklin, Tennessee. It turns out the president was among those who saw that video, and today he called out those protesters.
Our healthcare workers are heroes. They were the heroes when there was no vaccine. To the mayors, school superintendents, educators, local leaders who are standing up to the governors politicizing mask protection for our kids, thank you. Thank God that we have heroes like you. And I stand with you all. And America should as well.
And, Doctor, it is with a sense of urgency that we begin with you tonight. Are we anywhere near, in your judgment, the peak of this surge? And if you would, please talk about your fear for children heading back into the classroom.
You know, unfortunately, Brian, it doesn't look that way, because what you're seeing is, if you remember, this started in Missouri, went down to Arkansas, then spread eastward into across the Gulf Coast into Florida. Now that whole area in the south is filling in. But if you look at the map, it's now creeping up into Illinois, into the Midwest. So unfortunately, I think what's happening is we're seeing the Delta virus really pick off pretty much anyone who's unvaccinated at this point in areas where there's low vaccinations. I think the only places in the country that might escape Delta are the high vaccination areas in the Northeast, New England, Mid-Atlantic states. They'll have some trouble, but I think they'll weather it a lot better. And then the West Coast. So, but the South is getting hammered the worst right now because the vaccination rates are so profoundly low, and in a very unique way. They're low among young people, and that's who's piling into hospitals right now and into intensive care units and even pediatric hospitals. You know, in the Texas Medical Center, the median age of people in the hospital right now are in their 30s. And that's the new flavor of this Delta virus, is striking young people. And that's going to continue now for the foreseeable future, especially as schools start to open. I think that's going to act as an accelerant, especially in the southern schools where people don't have masks and the adolescent vaccination rates are around 15 to 25%.
Are you surprised that we now learn tonight that 1 million or so Americans, either connected or just concerned, or perhaps both, have found a way to line up for themselves a third vaccine shot? And do you think that in the reasonable future, it'll spread to those Americans not just immunocompromised who are allowed to get a third shot?
Yeah, I think that's what's happening. There's a lot of people going rogue at this point. They're seeing that Israel is now vaccinating individuals over the age of 60. They're not really getting a lot of clear communication of why the Pfizer CEO has said that we'll need a third immunization for Delta. Israel's doing it, but the U.S. doesn't feel it's necessary. And yet, anecdotally, they're hearing a lot of breakthrough cases. So there's kind of a disconnect, I think, between the White House Corona group communications and what they're seeing on the ground with hearing about friends and families getting symptomatic breakthrough cases. So I think that needs to be clarified. The answer, of course, is that hospitalizations among vaccinated people are not going up at this point, and we're not seeing deaths from it. But I think the rationale for how the U.S. government is planning on phasing in booster shots or third immunizations, as some would call it, needs to be clarified. So they've made it. Now they've said that immunocompromised individuals, those on immunosuppressive therapy, are going to requirement. But even then, they've not really specified. We know the data shows that solid organ transplant recipients need it, but they haven't really said, well, does that mean people on Humira monoclonal antibody therapy or so many others, maybe up to 5 to 7% of the U.S. population has some form of immunological issues, and do they all need it? And then what about older individuals, and how are they going to phase it in? So it's a little vague right now and a little bit chaotic, and I think people just responded and are saying, look, the shots are going unused anyway, I might as well just get it. And what they're doing is they're kind of more often than not faking it, meaning that they're not showing the vaccine card because they think the pharmacist and generally they won't give them the third shot. So they just say, well, I haven't been vaccinated before. And the problem of doing that is the level of safety data to support that is unknown. And so there's no publicly available or very little publicly available safety data. And that needs to be clarified by the U.S. government as well. So I think they've got to get their arms around this.